My name is Tim, here to talk to you about SLE, and I'm wearing a lab coat to seem like a medical professional. Systemic lupus erythematosus, commonly referred to as SLE or lupus, is an autoimmune disease characterized by autoantibodies, particularly anti-nuclear antibodies, also known as ANAs, which are present in nearly all lupus patients. It is an inflammatory response that attacks cell structures such as nucleic acids, a major element of DNA. In response, the body creates antibodies against itself, causing inflammation and damage to healthy tissues. The body goes through periods of remission where the symptoms lessen and periods of exacerbation where the symptoms worsen. It can affect any tissue or organ system in the body, mainly the skin, joints, kidney, heart, and lungs. Usually diagnosed in adulthood, although there are some pediatric cases. In the US, 9 out of 10 patients are women. Women are 8 to 10 times more likely than men. Women in childbearing ages, so between 20 and 40, and African Americans are most at risk. Now we're going to talk about when to seek medical care. Seeking medical care is important for early diagnosis. The cause is unknown, but research has shown that genetic predisposition and environmental, hormonal, and immunological elements are associated with lupus. Increased levels of estrogen exacerbate symptoms. Mood disorders are common. Blood disorders such as leukopenia, which can increase risk of infection, and thrombocytopenia, which can increase bleeding risk, may also develop. Often the first complaint is polyarthralgia, with morning stiffness and multiple joint pain bilaterally. Symptoms vary widely from person to person, but one may experience the butterfly rash on the nose and cheeks, which is most common, discoid rash on the back, fever, headache, muscle and joint pain, fatigue, and organ damage, mainly to the kidneys. Many of these symptoms can mimic other disorders, so be sure to discuss your concerns with your healthcare provider. Drugs such as hydralazine, procainamide, quinidine, phenytoin, isoniazid, or penicillamine can induce SLE-like reactions. Other clinical findings and symptoms include mouth sores, lung or heart inflammation, bone cancer and disease, abnormal blood levels, and neurological problems such as seizures, strokes, and psychosis. Shortness of breath may indicate problems such as pleural effusion and pleuritis due to vascular effects like atherosclerosis. A common kidney complication is nephrotic syndrome, with hypertension and bloody urine are common manifestations of kidney damage, as well as proteinuria, generalized and periorbital edema. Blue, pale, or ruber fingers may indicate Raynaud syndrome, also associated with kidney damage. Seek immediate medical care if these symptoms worsen. It can be fatal if not treated properly or allowed to progress.
Hello, my name is Ryan, and I am also wearing a lab coat so I look like a medical professional. So for our goals for treatment for lupus, we have two primary ones. We want to prevent the progressive organ injury as well as reduce the likelihood of exacerbations or these patient flare-ups. So a successful therapy treatment for lupus will depend on treating both these symptoms as well as the underlying inflammation. So lupus can be difficult to treat, similar to its difficulty in diagnosis because it can masquerade as other conditions. But being that lupus is an autoimmune disease, it can affect practically any tissues in the body. Therefore, our treatment must be tailored to fit both the severity as well as the location involved in this inflammatory reaction. So we need to fit the drug to the habits of the bug. So for all severities of lupus, usually our first line treatment or the first drug we try is the anti-malarial drug hydrochloroquine. We either use this alone or in conjunction with glucocorticosteroids for acute exacerbations, as well as the use of NSAIDs for reducing inflammation and pain. We classify lupus and its conditions based on the level of organ involvement. So we're just going to start with mild, which has no organ involvement. Our first line is still going to be the hydrochloroquine to suppress the inflammation around the joints and also for the fatigue and fever you may experience. We also have refractory drugs such as the glucocorticosteroids, which we use in low doses and only for short periods of time. Moving from mild to moderate, we have other secondary drug choices if the first are not getting the results that we want, where we have methotrexate as well as azoprine. Now we're moving into our major disease states, which involves organ involvement. For moderate, we have grade A refractory drugs, biologics, which are belimumab, which is a drug specifically synthesized for lupus, as well as other secondary options is calcineurin inhibitors, as well as moving into the more severe states as mycophenolate mofetil. And then we also have last resort drugs in grade C for our severe cases that we're having troubles getting under control. So talk with your doctor about which medications are going to be the right fit for you. As far as non-pharmacological options for lupus, probably the most important measure, particularly those with skin involvement, is going to be sun protection. So we need to cover up with clothing and brimmed hats, as well as wear sunscreen with at least a 30 plus SPF. Patients with lupus also have a high incidence of premature deaths from accelerated atherosclerosis disease, which is hardening of the arteries, and thus adherence to a more general cardioprotective lifestyle is highly encouraged. This can include things such as exercise, no smoking, controlled BMI, blood pressure, as well as glucose control and lipid control. For lipid control, we generally want to adhere to a diet low in saturated fats and a diet high in fish oils as well, which we have supplementations for. As well as these lifestyle changes, they can also help with the fatigue, depression, pain, and quality of life in lupus patients. Additionally, with that weight loss, though, that comes from the natural progression of exercise, BMI, blood pressure, and glucose control, is the weight loss can alleviate pressure from the joints, which is also why pregnancy can pose additional complications and further joint pains. With this condition, we also want to avoid live vaccinations, and especially in the presence of immunosuppressive agents, such as our biologics that we use. Lastly, estrogen contraceptive pills at high dose should be avoided, and they can be supplemented with progesterone pills, as well as other forms of contraceptive use. We do have certain clinical trials that are still ongoing, as for instance the UVA1 phototherapy. It does seem counterintuitive, as we do instruct patients to avoid UV radiation from the sun. However, we have found that with this high exposure of long-wave UV radiation has actually shown favorable effects on reducing disease activity. This treatment is approved and available in Europe, but we are still under investigation of it in the US. Acupuncture has also been a possibility as being useful for some of the symptoms of lupus, but it will not have an effect on the progression of the disease. Because of the nature of this disease, honest and open communication with your physician is vital. So lupus will require lifelong management, but we have many options available for the symptoms that you will experience during your lifetime of remissions and exacerbations.
Doctors. I think that one may have been